the idea is that it should be an independent inquiry, and it will be set up with independent experts from around the world. So the important thing is that it will have people from all parts of the world and with all types of expertise needed to look at what we've learned so far,
Mm.
what's gone well, what hasn't gone well, and what we can do differently, and what we can also keep on doing the same if it's working.
So the World Health Organization has come under tremendous scrutiny for its links to China. Can this investigation or this inquiry be truly independent?
It has to be truly independent. Any inquiry and all the kind of the scientific inquiries we do always have to be an independent. We actually have part of our organization is dedicated to working to ensure you eliminate conflicts of interests in the people who make decisions, and so it's in our DNA basically to ensure that people who are looking and reviewing are the people who are in the best position to be as honest and fair and accurate and scientifically accurate.
So can the WHO-led delegation meet and work independently of Chinese authorities?
I'm not quite sure what you mean by that question. Wherever we work, we have to work independently, but we also have to work in every country at the invitation of that country. So whether we're working in Australia, China, UK, anywhere, it has to be at the request of that country and has to be within the parameters of the country's request.
So you don't think, I guess the point is that you don't believe or you're confident that you won't get any interference from China if inspectors or if investigators do go into China to investigate?
So whenever we look for information, we ask for information, we ask for everybody, every country in the world to provide data to report, but we don't always get perfect reporting, no matter where. If you looked at our situation report, sometimes you'll see a country reporting 0. Now, that's not because that country's hiding anything. They just haven't got the data that day, and that applies across the board. So no, we never get perfection, but we try.
Will it be a goal or will you be able to hear firsthand from, let's say, frontline doctors in Wuhan who treated the very first patients?
So the details haven't been worked out, and it's not even clear what the nature of the inquiry will be, because the resolution came to the conclusion that there were many, many things to look at. The beginning of the outbreak is an extremely important thing to look at, but also what different countries have done and what has worked well and what has not worked well needs to be included.
How concerned would you be at the suggestion that this inquiry could be the trigger for a trade row in countries like Australia?
So certainly, again, our focus is health. And I think the best thing I can say is what my Director General said, which is that to beat this virus, we have to have national unity and global solidarity. So what we beg everyone to remember is this is about humanity versus the virus. Put all that aside. Let's work together. Let's beat this thing.
How do you feel, from a health point of view, how do you feel about all of these countries around the world that are reopening? When you think about the fact that the infection rate now has passed 5 million people.
Certainly, when countries have gone into lockdown, and the reason they've gone into lockdown is in order to slow down the transmission in the community while they can put the measures in place that we know will bring it right down. And that's the tracking, the tracing, the isolating, the strengthening the health service so that you can look after those who really need to be looked after and keep your death rates right down. Now, countries like Australia have got to that position. But when you bring people out of lockdown, you have to do it gently, because it's not just back to the norm, it's back to a new norm, and we're all learning what that looks like. So it has to be done very, very gently and carefully. We've put out a lot of guidance about how it can be done, but I think we are all on a learning curve. Hopefully it's a learning curve where we're bringing down our epidemic curves.
There is quite a debate that's taking place here in Australia at the moment about reopening our state borders. There is conflicting advice. The federal government saying one thing, state governments are saying something else. What's your view on travel within a country like Australia? Should that be allowed?
So certainly our view is know who is coming in, know where they've come from, and have a means to follow them. And whether that means you know where they're going to be and you ask them to isolate, whether it means that you simply stay in contact with them so that you have the option of monitoring them, monitor them when they come across the border, have a very clear idea what you're going to do and how you're going to keep your eyes on people who are moving.
So if people can be followed, if they can be tracked or traced, then crossing, say, a state border is acceptable in your opinion?
Especially if, again, you give them very good, clear information about what you need of them. So it's not simply just being external, but that every person who moves has a good reason to move, and is compliant, understands that it's their responsibility to prevent this transmission. It's their responsibility to honestly tell you where they're going and honestly check in with you. So it's about good community trust, good communication, as much as anything else.